So how safe is liposuction surgery? This is a question that has been asked to me millions of times. The most important thing is it is a very commonly performed cosmetic procedure, but it comes with so many misconceptions. People ask me, is liposuction safe? And the only answer is yes, it is absolutely safe, but it completely depends on the doctor that you're going to. To do a liposuction, always go to only a board certified plastic surgeon. All the problems that we see associated with liposuction is primarily people not going to plastic surgeons. So you understand what liposuction is first. Liposuction is not a weight loss surgery. It is a body contouring procedure that removes localized fat deposits to create a more sculpted shape. It works for people who are close to their ideal body weight but have stubborn fat in areas that don't respond to diet or exercise. Because the goal is refinement, not drastic reduction. So safety lies in precision and balance, removing just the right amount from the right areas. So what makes liposuction safe? Safety in liposuction begins long before the surgery itself. Here are the key elements. We do a pre-operative assessment. We make sure that every patient undergoes a complete medical evaluation. We review their health, their medication, their lifestyle factors like smoking and blood pressure control. Second thing is the volume limits. There is a safe limit to which fat can be removed in a single session. Exceeding that can increase the risk, which is why we plan more stages or more treatments rather than finishing it all in one stage and putting you at risk. The tumescent technique. So, you know that modern liposuction uses a tumescent fluid, which minimizes bleeding, reduces pain, and improves precision. It is one of the most important advances in making the procedure safer. Fourth and most importantly is that you go to an accredited facility with an experienced team and someone who's a plastic surgeon. Liposuction is always done in a sterile, well-equipped surgical setup with a trained anesthetist and nursing staff, not in unregulated clinics. Each of these factors adds a layer of safety that protects you before, during, and after the procedure. The anesthesia and monitoring. So depending on the extent of the procedure, liposuction can be performed under local anesthesia, sedation, or general anesthesia. At Tara Healthcare, we use monitored anesthesia, which means we usually use either some form of sedation or general anesthesia, because this ensures that your vital signs are tracked throughout the procedure. There is not an overboard burden of local anesthesia. We always have trained doctors around. Patient comfort and safety is our priority, not just the aesthetic result. So your post-operative care and recovery. The recovery phase is just as important for safety. We provide you with pressure garments to reduce the swelling, antibiotics to prevent infection, and detailed follow-up to track healing. Most patients can return to light activity within a few days and resume normal routines in about 2 weeks. Though complete recovery can take longer depending on the areas treated. So follow the doctor's instructions, hydrate well, rest well, and avoid any strenuous activity early on, which ensures a smoother recovery and better results. This is why the support you have at home is very important. If you have kids, make sure you're not too involved with the kids in the first 10 days. So yes, liposuction is safe when it's done firstly for the right reasons, which means for the right indications, by the right hands, and in the right setting. Never forget this. It's about how much fat you remove. It is about how carefully it's done. That is the difference between a result that looks good and in a patient who's truly healthy.